After a cup of coffee or tea, the learner audience is rejuvenated, I feel. We are going to discuss about the Rashtriya Bala Swasthya Karikrama, RBSK. Under this program, children are screened for 38 health conditions broadly classified under 4Ds. The aim of the program is to conduct the health screening as to identify children with health conditions, etc. The screening is conducted dedicated mobile health teams constituted with medical officers, staff nurses, etc. So the RBSK program is the objective of this scheme is 4Ds: defects at birth, deficiencies, developmental delays, and diseases. So for these things, a proactive screening takes place from the health department through the RBSK field visits. So the other objective of the program is reduction the under 5-year mortality rate. Under 5-year children should not die. Why should they die? To reduce out-of-pocket expenditures, it is always the common factor. The government of India, the government of Karnataka are stressing on the expenditure on part of the patient's beneficiaries for the sake of medical treatment. Improving mental and physical development in school children, increasing attendance in schools. 0 to 6 years children twice a year in rural and urban Anganwadi slums. To screen 6 to 8 years children once a year enrolled in government and government-aided schools. RBSK health conditions. This is a very important slide for you. Probably this may even some interest. So all the defects that are being corrected by the RBSK program from the tertiary care hospital, enrolled tertiary care hospitals free of cost. Say neural tube defects, Down syndrome, cleft lip palate, club foot. So all these things, diseases are taken care of. In adolescents, if you see that deficiencies, severe anemia, diseases, skin conditions, etc., defects of birth, development delays and disabilities like cognitive, motor delay, neuromotor impairment, behavior disorder, autism, adolescent problems like substance abuse, feel depressed, delay in menstruation cycles. So all these varied things are taken care of under this program. So this RBSK probably you are aware superficially, but routine immunization, all of you are aware. In the beginning session, I mentioned about this program. This is the immunization schedule, friends. All these immunizations are provided free of cost to the enumerated children in the field near their doorstep. See, you can see measles, rubella, Japanese encephalitis, fully immunization 9 to 11 months. So these are all the immunization schedules, achievements. On the right side, you can see the achievement. We have shown the achievement here. This is all HMIS data-based. We have got health management information system. These are totally data-based report that I am presenting before you. DPT booster. This is easy because they go to the school and they give the injections. And tetanus toxoid 10 years, tetanus toxoid 16 years. Preconception and prenatal diagnostic techniques, PCPNDT, an exclusive draconian law brought by government of by the Supreme Court to prevent the abortion of girl child. And they improve the child sex ratio 0 to 6 years. Prevent gender bias sex selective elimination. Ensure survival of girl child, to ensure mapping of the ultrasound machines, to ensure prompt quarterly report by ultrasound manufacturers and dealers. These are the activities that are being conducted, carried out under the PCPNDT Act 1994. Focusing on districts' lower child sex ratio, monitoring the sex ratio at birth, block, GP, municipality wise, review meetings and field inspection, monitoring in every 3 months of selected districts, orientation, sensitization of the judiciary at the state and district level. Many times the judiciary officers are not oriented. 2003, when I was the district health and family welfare officer in my Bangalore urban district, Bangalore urban district, correct. I raided one nursing home in Bangalore and I booked the case within 3 days. But unfortunately, that case was dismissed with a stricture against me. And I had to face the police inquiry also. Because the judiciary, though I went to the first class magistrate's house, gave the PCPNDT Act and told him that as a district health officer, I am the empowered person, that I can raid and I can search and I can file cases. But people expect that in the society, people expect that doctor should do only doctoring and nothing else. But doctors are given the powers of implementation of so many acts. Another is KPME Act, Karnataka Private Medical Establishment Act, this PCPNDT Act. So in these the police have no role. But the court, unfortunately, to my bad luck, did not take this into cognizance. So based on that experience, the Directorate of Health and Family Welfare Services thought of orientation of the judiciary also, so that the judicial officers can appreciate the grievance of the severity of the problem and guide the officers at the block level or at the district level. A total of 4,993 scanning centers are registered, of which 4,715 are private scanning centers and 270 are government scanning centers. Just imagine the number of scanning centers. Do you think that all these scanning centers people are very godly persons? No. See, because they go for these scanning centers because it fetches very quick money, fast cash by determining the sex of the fetus. Till date, a total 84 cases have been registered for violating PC and PNDT Act, of which 41 cases are penalized, for violation of 43 cases are pending for judgment. So you will appreciate that. You may have a question, why so many scanning centers are given permission, given license. The scanning center, there are benefits of the scanning also. See, you can prevent the fetal abnormalities and get it aborted. For example, Down syndrome. Why so many Down syndrome children are seen in the field, in the society? If the Down syndrome child is there detected in the scanning, it can be aborted. Or any other defect. Say birth defect child with severe mental retardation or with uncurable disease, that type of child can be immediately aborted within 12 weeks or within 18 weeks, whatever the case may be. In that way, scanning center is very useful to know the placement of the fetus also, presentation of the fetus also. This is very important. Progress of the labor also, some people ask for the scanning of the abdomen. Progress of the labor, very rare cases they see it, but nevertheless, 3 scanning are mandatory. 3 times scanning is mandatory to assess any fetal defects or malpresentation. Child sex ratio comparison as per census, India 927 ittu. Number of female girl children for the 1,000 boys, 927. So where are the other 60 or 70, 73 girls? Where have they gone? Missing girls. At least in 2011 census, still further reduction in case of India, in case of the country. Karnataka, there are 2 points enhancement. 946 was there in 2001 census. 948 is in 2011 census data. Unfortunately, because of COVID-19, 2021 census could not be held. And we always take the example of Kerala, wherein Kerala has got a very good favorable sex ratio. I heard some of the districts, the sex ratio is declining even in Kerala also. We always give the example of Mangaluru, South Canara, Dakshina Kannada, Udupi, Chikmagaluru in our case. These three districts, the all health indicators are comparable to Kerala. I honestly tell you, these three districts are high performing districts in our state, whether female literacy or child sex ratio or any other health indicator. It is very good in these three districts. So for internal comparison, I always give the examples of three districts. For external comparison, I go to Kerala, of course. Kerala, the benefits accrued for Kerala for the due to female literacy is very good. It's very important. The basic reason for Kerala's performance is the female literacy, high female literacy rate. In Tamil Nadu also female literacy rate is good. More than but it is not as good as the Kerala is there. But the female empowerment is very good in Tamil Nadu. In spite of female illiteracy is comparably low in Tamil Nadu. The empowerment is very good. I have seen the Tamilian population, wherein the woman takes decisions in most of the cases, and she is assertive also in case of woman. But unfortunately, it doesn't happen in Karnataka. Karnataka, south of Karnataka is very good. As I told you, Mangalore, Udupi, and Chikmagaluru, part of Chikmagaluru and Hassan are good. Yeah, actually, Kodagu is also must be good, but the tribal population residing in the Kodagu district will bring down the performance of the highly educated, highly forward Kodagi community. The northern Karnataka is very bad. All our indicators are brought down because of northern Karnataka. The status of women needs to be improved in northern Karnataka. Further improvement is required in case of northern Karnataka. Beyond, especially Kittur Karnataka, even the Kalyan Karnataka is rather, the improvement is needed. Not much of Kittur Karnataka is tolerably good, but Kalyan Karnataka performance need to be enhanced, need to be improved. Nutrition. For all our, whatever I have been telling, nutrition is the prerequisite for any health or education. Vitamin A administration is being given. Having said that, nutrition, the macronutrition is being done by the WCD department, but the micronutrition in case of health department for measles, rubella, and vitamin A program. 1 ml vitamin A solution containing 1 lakh IU is administered orally to children 9 months along with the measles, rubella immunization. This is a routine monthly program given to all the children, irrespective of the socio-economic condition of the child. Vitamin A supplementation program is there. Mass deworming program is there. I spoke to you earlier. Sorry. There are nutrition rehabilitation centers also for these severely malnourished and acutely malnourished. We prevent deaths due to severe acute malnutrition among children. We have got NRC's nutrition rehabilitation centers open in medical colleges and district hospitals. So there the child is admitted and the mother also will be kept there. She will be paid 125 rupees for her wage compensation is given, and child will be treated free of cost. Sorry, 275 to compensate the loss of wages, 120 for food and for parents, rupees 125 for food and rupees 120 for drugs of sample. This is the breakup. So this much of amount is being invested by the government to safeguard the interest of the malnourished children. Anemia Mukta Bharat is the new Poshan Abhiyan is being given, a call given by the central government, which state also accepts the Niti Ayoga has told that, see, through Poshan Abhiyan, the anemia should be controlled, anemia should be reduced. All the reproductive age group women should be given 15 to 49 years. So they should be administered iron folic acid tablets. So for a period of 1 year without any break. Comparison of NFHS 4 and NFHS 5 Karnataka. Stunting has come down for a period. Wasting has also come down in case of Karnataka. Severe wasting 2.1% has also come down. Underweight 2.3% has also come down, favorable for NFHS 4 to NFHS 5. But overweight, because of sedentary habits, overweight corresponds with the NCDs, increasing NCD, non-communicable diseases. You know that hypertension and diabetes is very much prevalent in the urban area. It is spreading to the rural, slowly it is spreading to the rural population also because of the sedentary type of work and the junk food. Junk food is a problem in my house also. I got two very beautiful grandchildren, but I cannot how they motivate you to buy them the the junk food. And just imagine the junk food motivation comes from seeing the advertisements in the TV. So we are really even today morning I bought say 2 packets of these noodles, masala noodles. Helpless. Somehow, as a old person, as a grandfather, I also plead helpless. I try to bargain with them, giving them some other, say, attractions, telling them that I will take them for a ride and other things. But whatever said and done, the present generation is very fast. They somehow motivate you to buy unwanted things, the things for them. If the parents are employed, the damage is more. National Iodine Deficiency Disorder Control Program is the program which is running from decades together. It is to prevent the goiter and prevent the malformed fetus. Iodine salt is very important to iodine deficiency disorders like cretinism, deaf, mutism, dumbness, physical and mental retardation, goiter, etc. These are the reasons why the iodine salt should be consumed. There are some nutritionists, there are some naturalists, naturopathies who advocate against iodine salt also. So this controversy is there always in the democracy, but it is a time-tested policy that salt should be iodized to prevent the thyroid malfunctioning and to prevent developed child. Quality assurance. You always have a doubt why the quality of the government hospitals is very poor, not up to the mark. Compare the private hospitals, corporate hospitals, how standard they keep themselves. But the quality comes with a cost. Quality doesn't come freely. In government hospitals, the footfall is very high, and all are rural folk and all are say poor people who do not have any idea about cleanliness or sanitation. Whereas the private or corporate hospitals, only the rich class people who have got the practice of cleanliness or hygiene will go visit. And they keep people, so many people to guide the persons, to educate them not to do any soiling there, other things. Or if some soiling is done, immediately people are there to wipe it, swipe it. But the government set up, all these things are luxury. But nevertheless, the government of India has introduced a quality assurance program. See, quality assurance program under NHM, Government of Karnataka. See, National Quality Assurance Program is there, Kayakalpa is there, Mera Aspatal, biomedical waste management was unheard of about 50-40 years back. Now biomedical waste is taken care of. And Swachha Swastha Sarvatra is another program where is the hospital cleanliness is linked with the community cleanliness also. Upgradation of the public, what is the goal and objective? Upgradation of public health facilities for NQS certification for 2000 by 2025. All public health facilities to qualify for Kayakalpa award. These are the things that are looked into for giving Kayakalpa award. Service provision under these headings. Patient right. There has been patient right, or there citizen help desk is there. Whether citizen charter is put up. Input, support services, clinical services, infection control, quality management outcome, and Kayakalpa 7 thematic areas: facility upkeep, sanitation, hygiene, waste management, infection control, support services, hygiene and promotion beyond hospital boundary. What is happening? Kayakalpa Sarvatra. This is the program under which beyond hospital boundary is also taken linked. So having said all these things, Ayushman Bharat Health and Wellness Centers. I spoke one or two words before the in the earlier session that the sub-centers which were there earlier, if any audience remember the sub-center building in the rural area or the peri-urban area, they will recollect that the ANM used to stay there. She used to make up for every 5,000 population, there is a sub-center, and sub-center building, 50% of the buildings are there in Karnataka. So there are 8,500 sanctioned posts of ANMs, sub-centers, but only around 4,500 buildings are there. So nearly 4,000 buildings are not there. But nowadays under health, Ayushman Bharat Health and Wellness Centers, we are constructing buildings. What we did was the primary health center was established for every, on an average 25,000 population. Government of India specifies 30,000 population should have one primary health center. But in case of Karnataka, we have got 990 primary health centers and a score of urban health centers. All these things included, so it comes to about 10,000 population, one primary health center is there. So the government of India told that, see, start building our the committee. That's how health and wellness centers came into picture. Packages of service under CPS UHCs, care in pregnancy and childbirth. These are the given in the. Is that the person who community health officer will head the health and wellness center in the rural area or peri-urban area. He has got 4 years staff nurse training. After selection, is given another 6 months training by the Indira Gandhi IGNOU, so that he is equipped with to treat the health problems of the rural folk. Neonatal infant health care services he provides, family planning, management of communicable disease, etc. Management of common communicable diseases, screening, prevention, control, management, etc. Care of, I am rushing through these things. Basic oral health care, elderly and palliative health care services is also provided. Elderly care and palliative health care is the requirement of the day. Palliative health care is given, not institutional palliative care. It should be community-oriented, community-based palliative health care. Institution-based palliative health care is meaningless, because when the elderly person becomes so old that he needs palliative care, there will be nobody to support him from the house if he is shifted to the institution. So whatever the treatment has to be provided within the house, the palliative care, that's how the Kerala model is working very well. In fact, I also conceptualized this type of communitized palliative care. Somehow the government of India took fancy for the institutional palliative care by reserving beds, reserving staff nurses appointed, providing staff nurses and other things. But rarely these old people suffering from terminal illness come to any major hospitals for taking any institutional care. Percentage will be less. Few people may go and get admitted there. Provision of wellness activities for health promotion, NCD camps they conduct. All these services are provided through the health and wellness centers. They are community based and they take care of only 5,000 population or 6,000 population on an average. About 3 to 4 villages surrounding the sub-center or health and wellness center. Rural park, see, you can see that the sub-centers that were planned for government of Karnataka in Karnataka state is 2,859 for 21-22. For 22-23, we want to establish all 8871 sub-centers as health and wellness centers. Apart from health and wellness centers, sub-centers, PSCs and UPHCs are also have been upgraded. The PSCs I said 1,990. The PSC number is 2,228. These figures differs because there are many people who manage data here. Every program has got its own data. So in the same presentation, you will get these very peculiar figures. You will have to bear with me. My apologies for that. Total 11,464 health and wellness centers the government of Karnataka plans by the end of 2023, 24. 22, 23 is there. It is extended by another 1 year. Mental health, very important. For all our problems, this is the main cause. I will just briefly, I will go discuss about these points. Cardiovascular disease, male, see, the female, the gender bias in the mental health also. Gender bias in the diseases also. We can see mental illness and substance use disorders. Female 7.1% of the population as per the global survey. In India, it is 5.4%. It is tolerably good. Diabetes. Globally 2.2%, female 2.6%. In India, it is 2.2%. The female are suffering from diabetes. Depression, depressive disorders. 1.3% in case of India. Female 2%. See, you can see, appreciate that women are having more of mental issues. I don't call it as mental disease or mental stress or mental problems, mental issues related to mental health. National Mental Health Survey 2015-16 confirmed that mental disorder constitute a significant source of morbidity in India, significantly affect quality of life. Manoroga, we call it as the mental health. So if some disease is not cured in spite of several months of treatment, we call it as colloquially Manoroga. He has got a mental problem. Risk groups 30 to 49 years. Burden of mental disorders among females is much greater than men. This is where gender bias is there. The audience should appreciate this. And for this greater mental disorder, the male, the husband, the spouse should not be the cause. Or the son should not be the cause. The husband should not be the cause. To that, or the father should not be the cause. So somewhere we'll have to strike a line and find that we communicate with the women folk more effectively so that the stress level is brought down. Poverty, low levels of education, working status are closely interlinked to mental disorder. And mental disorders continue to impoverishment. Epilepsy and intellectual disability are major public health problems. Epilepsy and intellectual disability. Treatment gap for mental disorder still remains very high. Mental illness, we don't take it considered as a mental health illness at all. Society thinks that she is depressed or some God's curse or something like that. So if some girl or some woman or somebody in the house is mentally unhealthy, immediately they go for a pilgrimage or go to some God. Let them go to God. I know nothing against it. But along with that, they should consult a qualified psychologist or psychiatrist and take treatment also. Common mental disorders are huge unrecognized source of burden. Severe mental disorders are still equally important. There is a very high prevalence of disorders due to misuse of alcohol, tobacco, and other substances. High suicide risk and increasing concern in India. Mental disorders are high in both urban and rural areas. Children and adolescents are vulnerable. 3 out of 4 persons with mental disorders have significant disability. The economic burden of mental disorders is huge, unmeasurable. Non-communicability is NCDs. So this is another problem which the female also suffer. I skip this slide. High NCD burden in Karnataka is there. As per district level household survey, 23.5% of adults have blood pressure above 140/90. 9.9% of adults have blood sugar levels above 140 milligrams. Cancer prevalence is 16 to 38%. Especially women, common cancer, cervical cancer is very common among the rural folk as well as the urban folk who have got multiple sexual partners. The vaccination is there now. The vaccination can be done. And this issue with cervical cancer can be kept away, provided they are vaccinated. The girls at the age of 12 or 14 years, they are vaccinated. It is not still implemented in the government program, but these vaccinations are available in the private. You can buy and get the girl children immunized. National Program for Cancer, Diabetes, Cardiovascular Disease and Stroke. This program is also there in the department. National Program for Mental Health Care and Elderly, for Healthcare and Elderly is also there in the department. And NPPC, National Program for Palliative Care, is also being run in the department, though in the nascent stages. Vision of NPPC program vision, the National Program for Healthcare of Elderly, creating new architecture for aging. It's all theoretical. I just skip this slide. Gender sensitive outcome. The health services has to be gender sensitive, both physical and epidemiological, because women and children are vulnerable population. I told you this. They are vulnerable to many diseases. They are vulnerable because of deprivation, malnourishment. They are vulnerable because they are neglected. They are vulnerable because their health needs taken are for granted. Women's anatomy, physiology, and psychology are different. This has to be appreciated by the society, the family, even the medical treating doctor also. A woman needs more nutrition as a child, as an adolescent, pregnant woman, a lactating mother. Without proper nutrition, proper health can't be achieved. Nutrition underlies all the health interventions. Woman is susceptible for nutritional anemia, which is the underlying cause for all her sickness. I told you, is an adolescent girl, she needs additional nutrition. Teenage pregnancy and delivery has a deleterious effect on her well-being. Pregnancy and childbirth are the greatest cause for maternal mortality and mortality, which the male does not get exposed. So there is a bias exposed for all these things. So woman is exposed for pregnancy and childbirth and other consequences, whereas the male doesn't get exposed. There is another side of the spectrum, that is nulliparous woman. Nobody has taken care of these things. Now the government of Karnataka has got a program. The minister was giving a statement that want to bring, see, these consultancy and services also for nulliparous women, for consummate through donors. Girl child is not welcome, more so as a second child. The child sex ratio has come down drastically in some of the northern states and is at below 900. Price of development, is it worth the price for so-called development? Sex selection termination is more during the second pregnancy. The statistics a plan for two children. The first one they want to have, they do not want to miss that first child, whether male or female. But second child, if it is the first child is female, second child become the choosy. They want to go for scanning center and determine the sex of the fetus, so that if it is again the female, they want to eliminate it, observe, or abort it. Sex determination for the sake of termination is still going on in spite of draconian PCP and ET law. This has got an adverse effect on the health of the woman in the society. Divorces and domestic violence has harmed the woman physically and psychologically, socially and culturally. I cannot comment on divorces, but I can comment on domestic violence. The male ill-treating the spouse, the son beating the mother is very common in Indian society. In COVID-19, we were not humans during COVID-19. We were all Rakshasas. We have proved that we were all demons. We abandoned our dead elderly people on the footpath on the roadside. So all has appeared in the paper. Really, this is a very bad thing that is happening in the society. But alas, child rearing and domestic work is not considered as economic activity by the so-called experts. Of course, 1991 it was not considered. 2001 and 2011 census, they just wanted to quantify it. Probably they have quantified it now. Quantification of this also has to be done by calculating the PQL of the woman, physical quality life index. Physical quality life index means what? A measure of human development and well-being combining three basic indicators as literacy at the age of 50, life expectancy at 0, and IMR. On these three parameters, from scale 1 to 100, we compress into a single index that is called as the physical quality life index. DALY, disability adjusted life years, it is a measure of healthy life lost, either through premature death or disability due to illness, injury, or accident. So DALY is also very high in case of male, not female. Nowadays, because even girls are riding the motorcycles and falling sick, the DALY may be quite high. I do not have any data for this. Exposure. Woman is exposed for all sorts of infectious diseases. HIV/AIDS, she is specifically vulnerable because she is forced into religious or economic flesh trade, not flesh trade. It should be flesh trade. Upper respiratory infection, TB, she is susceptible. Vaccine-borne disease and NCDs, this I explained to you. Cancers, I told you, sickness is not provided to her. She is exposed to several cancers because of her anatomy and sex. At old age, she is doubly more vulnerable because of epidemiological reasons and deprivation from the family. Constraint for gender and health, political health, economical, geographical, cultural, social constraints, professional constraints, attitudinal constraints. Workplace attitude, the male ignoring the female or harassing the female is very common. I always take classes for my young doctors. I tell them the ANMs and ASHAs are the honor of the department. The lady doctors are the honor of the department. They should be respected. So this is a call always given by in my class to the young doctors, young male doctors. MCS services depends on availability, acceptability of the services. Accessibility includes temporal accessibility also, time. It's very important. If we open the hospital between 9 and 4:30 and the people go to work early morning, wages, and come late in the evening, we tried in hospital, but it did not succeed. It did not click because only tablets were dispensed. I also worked there. And but the patients are conditioned to take injections. Some injection kodi. So in the evening clinics, injections are not given. So people are hesitant to come and access the services. Though any amount of tablets are given, they don't accept it. And Nama clinic, Nima clinic, and these things are we are doing jugglery to access to provide the services during the to fill up the gap of the temporal inaccessibility. Principal service, essential service should be universal, continuous service, accessible service, acceptable service, available service, affordable service, state-of-the-art technology made simple, IEC, responsive and responsible private sector. These are applicable to the provider, to me sitting in the directorate, or to my officer sitting in the directorate. All these things, parameters apply to them, principles apply to them. Health as a department, it is gender sensitive. I told to put the question, are we gender sensitive? As a department, we are gender sensitive. Gender balance has been achieved in case of health department. More than 50%, nearly 60% of the staff are women only. Certain jobs are earmarked for women, like a lady medical officer, auxiliary nurse, midwife, staff nurses, LHVs. All these are female-oriented jobs. Contractual women staff given maternity benefit and paternity leave also in case of National Health Mission. PCPND Act implemented vigorously for preventing sex discrimination and improving the child sex ratio. Health as an employer. How is health department as an employer? Gender, yes, we should be gender sensitive. Vishaka guidelines for safety of working women are implemented in the department. Vishaka guidelines are implemented. Monthly meetings should be held where the women's grievances shall be heard by the committee and appropriate remedial measures have to be taken. I as a district head, I worked in 2 districts. I constituted this committee, but nowadays probably monitoring. I should not complain here, but is the monitoring weak? We should put a question there. No preferential treatment for male versus female should be given. Health as an indicator is favorable to female. She lives longer, but it is a misguiding fact because males die very males die. The death of among males is more because of the vehicular accidents and the vices they develop, hypertension, diabetes due to drug abuse and other things, which is common among males. Maternal mortality ratio, this I discussed with you already. 97 per lakh laborers in case of government of in the country, 69 as per SRS data. Ayushman Bharat, Pradhan Mantri Jan Arogya Yojana, Arogya Karnataka, another 3 slides are there. I will leave you. You are also bored, I know. Karnataka health regime historical march. So earlier, see, the entire department was designed, architecture to take care of the MCH care or the RMCH care or the women and children as well as communicable diseases. But of late, what happened? Because of so many accidents and because of the longevity of the person, so many chronic diseases also are affecting the society. Accidents are happening. Secondary and tertiary care also has to be taken care of by the government. Now the government has to provide this care also. Otherwise, the poor people, the poor families will mortgage their property for taking treatment, and they become from poor to slum dwellers, from middle class to poor class. So the life gets downgraded. So these were some of the schemes which are prevailing in the state of Karnataka. Yashaswini is a cooperative society members rural and urban scheme. This is a paid scheme. Vajpayee Arogya, all BPL card holders have Vajpayee Arogya program wherein the cardiac and some heart related treatment were given. Rajiv Arogya Bhagya APL card holders. Rashtriya Swasthya Bima Yojana BPL as per GOI norms. But this did not click because a premium was expected by the government of India and nobody in Indian context is willing to buy his insurance policy except the few educated, few highly paid officers like ITBT, wherein even the firms offer them the very reasonable and attractive insurance packages. The insurance care now has become a very dominating feature and a very attractive business for the multinational companies. Many national companies are operating, no doubt, but one should have a insurance coverage. Otherwise, you just do not know, because the medical treatment has become so dearer, so costly. Dearer means costly, that nobody can afford, and you will have to sell out your property, sell out yourself, sell out kidney, heart, and other things. Not heart, kidney and other things to get treatment. Mukhyamantri Santvana Harish Yojana, this you remember, one accident occurred in the Nelamangala road, and that Harish was both his legs were cut. He was heavily bleeding. He was sitting in spite of that and asking for help. But everybody, the onlookers, were only trying to video him and upload it to some paper or some TV. Upload and sell it to some TV. So that's Santvana Harish. He died on the spot. But government of Karnataka, during the period, the same government was there, and Abdul Kader sir was the health minister. He immediately motivated the health minister, the chief minister, to keep a 2 crore rupee fund for this accident victims. Indra Suraksha Yojana for farmers. So all these things have been clubbed together to implement the Ayushman Bharath-Arogya Karnataka scheme. Ayushman Bharat is a central government scheme. Arogya Karnataka scheme is a state government scheme. Ayushman Bharath-Arogya Karnataka scheme. In the central scheme, the coverage is up to 5 lakhs rupees of treatment, either in the government setup or a empaneled private hospital will be given. It is an annual flow. It is a family floater. And earlier in the Arogya Karnataka, only 2 lakhs limit was given, cap was given. But in ABPMJY, means Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, 5 lakhs cap is there. For this, the requirement is entitlement comes from the ration card, BPL ration card, and the eligibility comes from the local, the Karnataka issued this Aadhaar card. So Aadhaar and ration card are the must to access services. Based on these two things, we are in Karnataka state, we are issuing the Ayushman Bharath-Arogya Karnataka health ID card also. And in Karnataka, we have got another very attractive thing. We have taken care of the missing middle also, wherein the APL card, ration card owners and the natives of Karnataka state will get 1.5 lakhs rupees. 30% of the government package is reimbursed to the facility. So up to the rupees 1.5 lakhs rupees per family per year. There are nearly 1,600 packages available, including 36 class specialty packages. Treatment can be availed based on Aadhaar card and ration card. For the entitlement, ration card. For acceptability, Aadhaar card. It excludes this Ayushman Bharat Arogya Karnataka because Arogya Karnataka, we call it because this component is there. We have retained our state's name because the missing middle component is there. In Ayushman Bharat, this missing middle, they don't reimburse the amount. And Andhra Pradesh and Tamil Nadu, they have got better schemes also are there. They give full coverage and free access in the treatment in the private hospital also is provided. Ayushman Bharat PMJ Arogya Karnataka progress, 31 districts covered across the state. 3,483 hospitals are giving the services. Public 2,947 and private hospital 536 have empaneled throughout the state. 66.48 lakhs beneficiaries have been treated till October 2023. The program was launched on 2nd March 2018. Since then, 66.48 lakhs people have been treated. 5.69 crore beneficiaries covered under the scheme. This is the 5.69 crore beneficiaries means excluding the private insurance holders, excluding the central government employees residing in Karnataka and state government employees. This is the out of 7 crores population. If we remove these things, population, 5.69 crores will be the targeted beneficiaries. 1.55 crores cards are being issued through the EDCS. EDCS is the agency, electronic delivery of citizen services. They are issuing these cards. Even without the ABRK cards, if one has got the state issued Aadhaar card and ration card, they can produce in any empaneled hospital and get treatment. Approved cost of treatment so far for the past 4 years. Friends, you should remember 7,044 crores has been spent on treatment of these mostly BPL patients. The APL people do not access these services to such an extent. Only the uptake of services for the APL families is only to the tune of 15%. 85% of the people are the BPL people who access these services, and the amount spent towards treatment, this amount is not paid to the patient. This is reimbursed to the hospital where the patient is treated. 7,044 crores has been spent. So many lives have been saved. So many disabilities have been prevented. And so many the families have been prevented from bankruptcy. By working together, pooling our resources and building on our strengths, we can accomplish great things. I conclude my talk on this subject, health and gender. If there are any interactions, if there are any suggestions, I'm ready to take them. Otherwise, before vote of thanks is given to me by my dearest uh, audience. And Nanjan Swami, I thank all of you for having given a very patient listening on this subject today, in this afternoon. Thank you very much. Nanjan Swami ಅವರು